So my name is Elissa Hansen. I'm the president and CEO of Northspan. Northspan is the organization that powers the North Force program. And so we're really happy to have you here today. Our agenda looks just like this. We're just gonna do some quick introductions so you get to hear from quickly the North Force team that's here. We have three great organizations, businesses presenting to us about what they are doing, who they are, and the types of people they are looking for. And we'll have some time for some questions and answers. So we've got some questions queued up, but for those who are here, if you have any questions, your curiosities or comments, feel free to use that chat. So we're in Zoom. You do have full capability to unmute yourself or turn off and on your video. And if you just have any issues seen or anything, please let us know. We'll try to figure that out. And to use that chat, it's down here in that bottom space to type your questions in there, comments that you might have, or we will open it up if people have any questions that they have and they would like to verbalize as well. So real quickly, just want to give an opportunity to Desiree and then Kara, if you just want to introduce yourselves and so folks can see your faces.
Yeah, absolutely. So hi, everyone. I'm Desiree Yorzik. I'm the Greater Northeastern Minnesota Strategy and Development Consultant for North Force.
And Kara.
Hi, everyone. My name is Kara, and I am Desiree's counterpart here in the Twin Ports and Northwest Wisconsin region.
Awesome. Thank you. So today we're excited. We have Kim Burke from Essentia Health, Taylor McCormick with St. Luke's, and Stacy Kusanen, which I probably didn't say that right, but she will let me know when we get there, from Blue Cross Blue Shield. So first we will have Kim, and you all have the ability to share your screen. So I'm just going to stop my share and we'll go right to Kim. And then when Kim's done, we'll go to Taylor and then Stacy, and then we've got questions for the three of you folks. So feel free to take over, Kim.
Can you see my screen?
I can see your whole screen. Yep, now we can see that PowerPoint.
Awesome. Okay. Well, thank you everyone for joining us today. I'd like to introduce myself. I'm Kim Burke with Essentia Health, and I work in workforce development with Essentia. So just wanted to tell you a little bit about Essentia Health. We're a large healthcare system, and we'll go into numbers and things a little bit later. We do everything from ambulance to, clinic, hospital, surgeries, all of those types of things. Just wanted to point out our mission and values. All the decisions made at Essentia Health are based around the values in the mission. So if there's ever questions about how to move forward with some bigger decisions in the company, these are always reviewed in making decisions. So it's something that we live. It's not just something that is on paper. Here's just a brief overview of our locations. We're spread out, Wisconsin a little bit, a lot of northern Minnesota, and then over into Fargo. In July, I believe it's July, we will be integrating with another large healthcare system, which has 17 sites, and we'll have many more facilities in North Dakota, and then kind of in the Brainerd, Detroit Lakes areas of Minnesota as well. So currently we have approximately 13,500 colleagues. We'll be gaining 5,000 more with our integration. So we'll be pushing 20,000 at that point. We have 2,100 physicians and advanced practice providers, and that's like nurse practitioners, therapists, anyone who bills their time as an advanced practice provider. We have 14 hospitals, 70 clinics, 12 long-term care and assisted living facilities, 5 ambulance services, 1 research institute, 549,000 unique patients, approximately 1,452,000 clinic encounters, 177,000 patient days in hospital, and 154,000 emergency department visits per year. So they're busy. Here's some of our top vacancies at Essentia Health right now. They're hard to fill. There's not enough students going into these programs. There's not enough programs offered in our local areas. So these are some areas we're really concentrating on in workforce development and trying to recruit people from our area and outside the area for these positions. Registered nursing is always something that we're looking for and hiring for. So you can't go wrong with a degree in registered nursing. Also nursing assistants, which are oftentimes called CNAs. There's a huge need for nursing assistants at all times. Nursing assistant program is a very short program. I believe it's 40 hours of education and then exam. And there's a huge need for those. They're great positions for students while going to school. And I know Scholastica offers a nursing assistant program as well as Lake Superior College at this time. And then in long-term care, which is assisted livings and nursing homes, there's always a large need for nursing assistants there as well. Another area that we really have a huge need for is a medical assistant, which is a one-year program at Lake Superior College in the area. And medical assistants do a lot of the rooming of patients' vitals. They can give injections. They do a lot of the administrative work as well. Also qualified for a medical assistant position is an LPN. So, most of our jobs are posted as a medical assistant and LPN together for those needs. Any kind of educational background in either of those areas can be hired into our medical assistant positions. And at Essentia, we call them clinical assistants, which is a little different than the names of the programs, basically due to the fact that these are clinic positions, which are no nights and weekends in the day shifts in the clinics. Also, there's a large need in our laboratory right now, medical lab technicians, which is a 2-year program, medical lab scientists, which is a 4-year program, and then phlebotomists. Phlebotomists, we will train on the job, which is also a great program for students that are looking to work while they're going to school. Shifts are flexible and full-time equivalents are flexible. For example, you could choose to work a casual status and be on call, or you could choose to, work 2 days a week, 4 days a week, whatever works. We also have nutrition service assistant needs, which is working in our dietary. And that could be anything from preparing food, checking out customers in our cafeterias, and bringing trays to patients' rooms, preparing meals for catering meetings, all kinds of different things you can do there. And then another huge need for us right now is radiology techs, which are your x-ray techs. And then with more, and that's a 2-year program at Lake Superior College in this area. And with more education and experience, you can move up into, specialty techs like MRI techs, CT techs, things like that. So some of our benefits, we offer kind of a basic benefit package that I think most companies offer, but we offer medical, dental, life insurance, disability, flex spending accounts, employee assistant program, retirement plan, 401k, family medical leave, paid time off. You can take out benefits on your spouse or your children or dependents. And then there's other voluntary benefits. We also offer tuition reimbursement after 3 months of employment at a 3 days a week FTE. And then we also offer professional development opportunities within our organization. Just some things we've been recognized for is best medical facility in the Red River Valley in the Fargo area. Our Brainerd Hospital was honored with top 100 rural hospital, and the Duluth facility was ranked number 4 hospital in Minnesota by US News and World Report. We've also been recognized for our stroke care, heart attack care, controlling high blood pressure, trauma care, technology and electronic health records, our OB, baby-friendly labor and delivery services, coordinated care of care organization, and service and quality. Essentia scored as a top performer in 14 out of 23 measures in 2019, and only 2 other healthcare providers in the state were top performers in these measures. We've also been rated as a 4-star hospital for Duluth, Fargo. St. Joe's is in Brainerd, St. Mary's is in Duluth, St. Mary's of Superior, and St. Mary's in Detroit Lakes. We have a project going on right now, which many of you have maybe seen, Vision Northland, where we're building a new clinic and hospital tower. It's a $900 million project, and we hope to have that open if we stay on track in fall of 2023. It'll all be state of the art, and the employees were very instrumental in designing this. Nurses were brought in to see what worked most efficiently for the design of the rooms for them, and that gave a lot of insight to those who were designing this. So just how to apply for positions or search for positions with Essentia. You can just go to essentiacareers.org, and you can search for keywords. Say you're looking for a phlebotomist position to work while you're going through school. You can type in phlebotomist. You can say Duluth, Minnesota, Superior, Wisconsin, or within a certain mile radius. So for example, this was a search that was done, which shows all the different filters once you get in there that you can search by job category, state, city, facility, job type, and time type. And job type would be full-time, part-time, whatever works with your schedules. Once you get into a certain position, the details will be provided as far as what the job is all about, the requirements for the position, and you can apply right there on a position. One thing I will mention is that we are bound by regulations to hire people that have the exact qualifications that are listed. We cannot hire people that are almost to that qualification or have something similar. So when applying, make sure that you do have the exact qualifications that are listed. Otherwise, you likely won't be looked at. So applying for a job with Essentia, and I can send this out after the fact for people or make this available. This will take you through the steps for creating your account. There's a way to set up job notifications. And once you're in there and have applications, you can go in and view your statuses. And here's just different ways to stay connected to Essentia. EssentiaHealth.org is our main webpage, which provides a lot of information on our mission, vision, financials, any kind of questions you'd have about Essentia. Essentia Careers will take you to our right to the careers website where you can search for jobs and apply for jobs. We're also on LinkedIn, Facebook, and Instagram. And I know we have time for questions after all the presentations, so I will stop there and answer questions after the presentations are done.
Awesome, Kim. Thank you so much.
You're welcome.
We will hand it over to Taylor. Hopefully it's working for you, Taylor.
All right, yeah, let's see if I can get this going here. Alrighty, can you hear me okay?
We can hear you great.
Perfect. It'll just be a matter of if I can get my screen to share here. Just 1 second. I'll just introduce myself while it's loading here. So my name is Taylor McCormick. I am a senior recruiter with St. Luke's Hospital in Duluth here working in HR. And so just have a presentation here, if this will load, to go through everything. Come on. Okay, here we go.
There we go. Success.
It's working? Good.
Yeah, if you do it in the presentation mode, it'll get a little bigger for us. Yeah.
All right. Can see it okay?
Yes.
Perfect, perfect. Well, sorry about that. So yeah, I will be going over a little bit more about St. Luke's. So we are a healthcare system here in the Duluth area. So we are a nonprofit hospital here in Duluth, as well as private. And so we have our two hospitals, which include St. Luke's here in Duluth, as well as our Lakeview Hospital up in Two Harbors. And that includes also 40 primary and specialty care clinics, as well as 2 pharmacies. So really just in the region here into Wisconsin, as well as serving some UP people as well in Michigan. And so we were founded in 1881. We were actually the first hospital here in Duluth, which is kind of a fun fact. And even though we've grown over time, we still retain our re-owned patient-centered focus. And so right now we have about 3,000 employees in the region, which make up, across our clinics and hospitals here. And our mission statement is the patient above all else. And what's really cool about that is that we truly live up to that. I think when you're walking through the hallways, and if you've been on site here, you can really truly see it in the within our employees, as well as even just our patients being here. And it's really not just a writing on the wall. People truly, we hire people that are passionate about not only healthcare, but just people that care for our community. So, it's really lived out every day. And our vision is to be the provider and partner of choice for our region. This is just a map of really all of our offerings and where we are. And so, like I said before, you can see that, we have our main campus here in Duluth, and then we have a clinic in Superior, as well as Ashland, Wisconsin. And then we do have clinics up in the range as well in Mountain Iron and Hibbing. And then we do have the Lakeview Hospital, a Silver Bay Clinic, and we do work really closely with the hospital up in Grand Marais as well. So those are both hospitals that we partner really closely with up the shore a little bit. So that's just a good map to see where all of our locations are. Our organizational values, we actually just revamped these in the last year. And so we got a lot of employee feedback. We talked in, different group settings just to go through, what are our values and how do we want to live those out every day and take them very seriously. So the 4 values that we recently implemented include compassion, safety, quality, and teamwork. And so when we're hiring and going through the hiring process, we really like to, ask questions to candidates about these areas, because they are, what we focus on and what we really pride ourselves on of, coming in that door every single day and, living up to our values that really work, are really close in comparison with our mission statement. So those are those. Just a little bit more about us and why us. And so we were actually voted the best medical facility in the Duluth News Tribune, Best of the Best Awards for the 2nd year in a row, as well as one of the top places to work. Like I said before, our employees truly live up to our mission statement and values. And, we are large enough of an organization that allows room for growth in your career. But it's also small enough to really make a difference and a positive impact in our community. We're small enough where, we want to hear your voice. We want to hear what people have to say and what changes we can make to, better live up to that mission statement. And we also raise money to support community organizations, and we offer education and outreach programs as well as volunteer efforts. And so, partnering with our local community is really what we're all about and what we pride ourselves on. So any opportunity to be a part of, fundraisers or different programs, St. Luke's is always, at the table for that. Types of jobs that we hire for, a lot of it is very similar to what Kim said at Essentia here. So just a few of the areas to give you an example, patient care areas that have higher volumes of positions include nursing, becoming a nursing assistant, a medical assistant, we have LPNs in our hospital. And so a lot of those programs, it really just depends on, what you want to go to school for, what you're interested in. But we do accept, both associate level nursing degrees as well as the bachelor's level. And so as long as you're certified and on the board of nursing, you can become a nurse at St. Luke's. So you really have the option to be, either a 2-year nurse or go to school for 4 years. And then a lot of those other programs, just vary between, 1 to 2 years that are listed on that one. So allied health is another one. So a lot of our lab positions, MLT, the medical lab technicians and scientists, and those range between 2 to 4 years. Radiology, physical therapy, pharmacy, a lot of those programs really vary depending on, what you want to do and where you want to go. We hire a lot of professional, clerical, and leadership positions that are non-patient care related. So, we have a human resources team, we have an accounting team, marketing, information technology, as well as really leadership opportunities, both across nursing as well as clinics and all of our non-patient care areas. So, definitely opportunity to grow. We do hire physicians and nurse practitioners, physician assistants, everything within that advanced practice provider area, as well as hospitality, which we do have usually a high volume of opportunity for, which are really great and flexible for getting your foot in the door and wanting to just see what healthcare is all about. So nutrition, we have housekeeping, room service where you can bring in food to patient rooms and help with their diet plans and things like that. So like I said, a lot of our positions might require a specific, license or, to go to school for a specific program. And we have that all listed on our website, which I'll go through here in just a second. Internship wise, we do have a lot of different student experiences and clinicals on site here at St. Luke's. So we partner with a lot of different programs and schools across the region for, nursing clinicals, as well as different lab positions and, other areas within that realm. But we also actually hire like clinic management interns as well within our clinics, where a lot of different healthcare management level majors can, shadow and work really closely with our clinic management team to really understand, what healthcare management's all about. So we do have a program that we hire for that every year. And then kind of miscellaneous across the board. We don't have a very large marketing, accounting, HR team, but we do hire interns across those areas as well. So yeah, some internships are paid, others aren't, just depending, and if they're college credit or, if they're just as an experience for students to get some experience within their realm. So we do hire interns every year, just depending on the area and the timing, but I'll go into that a little bit more here in a few slides. But how you can apply and how you can view all of our openings and positions online, I'll put the website on here, but we do have an online application process, and I think Kim said this a little bit too, but we do have to hire, we hire people within positions as long as they meet those qualifications that we have posted on the position. So it'll have everything on there of what our qualifications are depending on the position, but each position will show if they are, what shift they are, what the hours are. It'll have that FTE, which I explained here, of if it's full-time, maybe it's part-time. We do offer our benefits package to all positions at a 0.6 FTE and above. And so anyone that works 24 hours a week and above are eligible for our benefits package, which we have really, really competitive health and dental plans that, give you an option to choose between various plans, as well as like a matching 401k. We actually have a pension here at St. Luke's, which I know is a little bit harder to find these days, but a lot of great retirement opportunities, competitive wages. We do have education reimbursement as well if you ever want to go back to school and are working at St. Luke's and want to advance your career within a specific area. So, we do really want to grow our own employees and grow from within if we can and promote. So that's really something we like to push and have people, try out new things and challenge themselves. And so this is a copy, or here's a link to our website, which I can send over to, but it has everything on our website as far as like positions go in different categories. So, we're always hiring. We have, different times of the year that we hire more for various areas, but overall, all of our internships and all of our careers are all posted right online on our website. So you can see in real time what's available and what we have, what we're hiring for. So happy to, like I said, answer any questions, and there's my contact information as well. But yeah, happy to answer questions at the end here too, but that's all I have.
Great, thank you so much, Taylor. We will pass it right over to Stacy with Blue Cross Blue Shield.
Good afternoon. I'll just bring up my screen here. Okay, well, welcome to Blue Cross and Blue Shield of Minnesota, where we inspire change, transform care, and improve health. We will cover who we are, what we do, why we're the best place to work, and a report out to the community and how to apply. We have a long-standing history in the state of Minnesota. We've been in business for over 80 years. We are the first health plan to be known as Blue Cross. We are the leading health plan in Minnesota with just about 2.6 million members. We have multiple locations across the state. We have buildings in Eagan, St. Paul, some retail locations that are currently virtual, and locations up on the Iron Range in Virginia. Our members reach from every spot in the state to all over the country and on all 4 continents. So we have members far and wide. The Virginia site opened, a little bit history, it opened in August of 2002. The first customer service classes were actually held at the high school until our contact center doors opened in 2003. We employ over 500 employees. And prior to COVID, we only had 25% of those working from home. But during March of 2020, we spent 1 week focused on moving our entire staff to a work from home status, ensuring that everyone was able to keep their jobs and working full time. The only employees that were left in the office were mailroom and essential employees. In the spring of 2021, we announced that most of our contact centers would be 100% remote, with minimum staff being hybrid or designated to work in the office. So if you're hired today, you go through a 9 to 12 week virtual training, very interactive. We teach you the most important stuff and then send you up with a mentor that guides you the rest of the way and helps you with all of the important essential things you need to know about working for us. The northern offices basically have customer service representatives, claims representatives, business analysts. We have compliance appeals level positions in our offices as well. You can also be a supervisor, a technical specialist. We hire nurses to help with our care management, case management. So lots of opportunities. Our future looks a little bit different. We are going remote. So we've spent the last year building really successful virtual teams. We have sent our entire staff through some culture unfreezing sessions through the Sendelany organization, and that is from the top down. So even your entry-level customer service, maintenance guys, they all go through the unfreezing session because we know it starts with one person and each person making that culture change. In 2021, it also brings a new set of opportunities that we're working on to advance our social impact work. So we look forward to strengthening relationships within our communities, to discover new collaborations, and ultimately identifying together on new strategies to combat racism and reshape the healthcare system from the inside out. In the news, Blue Cross just supported a racial justice legislative resolution which declared racism a public health crisis, and it created a new House Racial Justice Committee. I have a video in here. In the essence of time, I will send out the slide deck and make it available for all of you to watch. Rosamond is our Health Equity Integration Director, and she does a fantastic job leading these initiatives. Our environment is where employees are innovative and empowered to make decisions that align with our vision and mission. Our culture is focused on collaboration, teamwork, diversity, and inclusion. We're committed to the health of our members, and that extends into our employees as well. You'll see in the following slides tons of benefits and things that support our employees to make sure they're healthy and well. At Blue Cross, we value our employees, and our leaders work to provide a supportive environment where you can bring your authentic self to work. We also like to have fun. So part of our culture survey, in the beginning of our culture shaping efforts, our number one call out was that we like to have fun here. So 2020 has changed what that looks like. So now we've done all of these things on the screen: virtual bingo, Jeopardy, Kahoot, virtual customer service weeks, virtual engagement chats, summer and winter Olympic games, or a save it or shave it contest. That was for the food drive recently. And two gentlemen went up against each other, and you could donate your funds to either team. And whoever raised the most money got to shave it, and the other one got to save it. So that was super fun. But down to business, what we do. So our vision, mission, and values is what sets us apart. We are the customer's first choice, and we will continue to do that by reinventing ourselves and the system. We inspire change, transform care, improve health for the people that we serve. And we live by our values. Similar to Essentia and St. Luke's, our values are in every decision we make. We have 6 values. They are put the customer first, be remarkable, succeed together, own it, find a better way, and do the right thing. Our performance reviews with our employees are based 50% on the what, so their job goals, performance metrics, and then 50% of the values. So they are weighted pretty heavily in our organization. What does customer service look like at Blue Cross? We are not your typical call center. Of course, we're virtual now, so we're all at our homes, and we put the customer's experience first in all that we do. We focus on providing accurate and timely responses that our customers and our providers can get back to their lives and their business. We are customer advocates. We answer questions resolving issues for our members regarding their policy, their health, wellness, financial, and self-service programs. Through COVID, we have seen an increase in escalated calls, highly emotional calls. We do a lot of calls with Medicare members, and so our associates get to hear all of the hard things in their lives about health and finances, which are 2 of the biggest things. So when we hire for our customer service teams, we look for people who have a heart for service, who can display empathy and compassion and make connections with our members and providers. We do that all over the phone. We also look for intermediate computer navigation and typing skills, de-escalation and recovery techniques, and the ability to reach out when in need for assistance on those really difficult calls. It's not an entry-level position by any means. It requires to not necessarily know all the information, but documented skills in research, navigation, and confidence in those skills to give a solid resolution. Our employee pay and benefits is a great package. Our customer service representatives start at $16.50 to $17.50, depending on their experience. We offer medical, dental, vision benefits, and those start on day one with no waiting period. Blue Cross also pays a portion of those. There are ways to increase your earning potential, so annual raises up to 6%. Quarterly bonuses that range from 4 to 8%. And if you work a late or a weekend schedule, you can receive a 10% premium pay on the hours that are late or on the weekends. We also offer paid time off. So our employees accrue about 3.5 weeks of paid time off the first year. You accrue it as you go. So every 2 weeks you get a dump of PTO in your bank. It combines with sick time as well, so our employees have to manage that. We offer a 401k plan that offers a match. We also offer a pension plan, which is rare these days, and you are fully vested in that after 3 years of service. Career development is huge for us. Passion is the difference between having a job or having a career. And over the past 2 years, we've averaged a 12% internal promotional rate. So we love seeing our people grow and develop within. We also offer tuition reimbursement after 6 months of employment, and the maximum is $5,250 per calendar year. It's also available for part-time employees on a prorated basis. You can see that supervisors and leadership are extremely involved in development. We have monthly meetings, development and goal planning sessions, quarterly check-ins, year-end performance reviews, online resources to assist in personal and professional development, mentoring programs, and virtual training programs on technology. So we make a healthy difference in our employees' lives by offering flexible schedules. So flex shifts, you can start from 7 a.m. to 11:30 a.m. We offer the ability to trade shifts. We offer permanent late shifts, weekend schedules, 10-hour shifts, part-time options, remote work availability. And we really want our employees to balance their work and home life. And so this is just one of the ways we support that. We care about your health as well. So we offer a lot of programs on the screen that support your health and wellness, fitness opportunities. We offer paid caregiver leave, which is 2 weeks to transition your loved ones into assisted living or nursing home. We offer 6 weeks paid maternity leave for both the mom and the dad if they work for us. We also offer paid bereavement leave up to 5 days for a loved one. We have employee resource groups. So Blue Cross promotes a respectful work environment where all employees can reach their full potential. These groups focus on diversity and inclusion within our business, and they offer employees a chance to collaborate and know others in our company. We have our VETS organization, which we are the first health plan in Minnesota to be designated a Beyond the Yellow Ribbon company for our support of service members, veterans, and their family. We were also named the best place to work for LGBT equality, and it's important in sustaining the work and the talented workforce that we have. You can see some also additional resource groups on the screen that do a lot of great work within our organization. Our work in the community is really important to us. We offer our employees 20 hours of volunteer paid time off to use in addition to their regular time off. Our volunteer committee coordinates Meals on Wheels, blood drives, highway cleanup, Habitat for Humanity outings, and much more. Despite social distancing and working remote, in 2020, our staff donated 30,223 volunteer hours. And that was by 1,078 of our associates. And by 2025, we're on a mission to donate 100,000 hours. So it's a very, very big thing that we're working towards. A little bit more facts about how we give back to the community. $14.8 million were given to organizations in 2020. Combined with last year's, a total of $15.5 million, that brings us up to $30.3 million towards our $100 million goal by 2025. We increased our PTO last year, our VPTO last year, to 40 hours for associates to sew masks or be out in the community donating. We have giving gardens on site at each of our locations. So we donated over 1,500 pounds of fresh produce. $1.4 million were granted to 40 nonprofits to further our supporting efforts related to childcare, food access, economic insecurity, homelessness, and housing insecurities. Our staff made 80,000 masks, and we coordinated with volunteers to do that. We donated them statewide to healthcare providers, community nonprofits to protect against COVID-19. And when times are hard, we are there. And so I want to share this video of our COVID-19 efforts.
2020 will be marked by the COVID-19 pandemic and its impact on our community. At Blue Cross and Blue Shield of Minnesota, we knew we had to act fast and shift our focus to meet the growing needs of our members, healthcare workers, and communities we serve. First, we committed to fully covering all costs associated with COVID-19 testing, treatment, and vaccines. We quickly expanded coverage for office and telehealth visits and prioritized our commitment to community health workers. We accelerated our payments to providers and offered premium rebates for our members. We distributed COVID-19 emergency relief grants to our nonprofit partners. Pandemics can accelerate needs and require additional support. At Blue Cross, we focused on keeping our members safe, provided seniors with resources to stay positive through our Medicare campaign, and elevated our online mental health program. Through our Food as Medicine initiative with North Memorial Health and a $750,000 donation to Second Harvest Heartland, we were able to assist with food security. Our Blue Cross associates volunteered their time as contact tracers for the Minnesota Department of Health, and our Chief Medical Officer, Dr. Mark Steffen, provided a trusted source of insightful information through a series of blog posts. We partnered with other Minnesota providers in a mask-making initiative to protect our healthcare workers from COVID-19 and keep our communities safe and healthy. Our work would not be as impactful without our trailblazer healthcare heroes and all the dedicated healthcare workers in our community. The pandemic exposed some of the biggest health inequities across our vast and diverse communities. At Blue Cross, we are committed to our members and community partners who share our mission to inspire change, transform care, and improve health. Learn more about our COVID-19 efforts and how you can get involved at bluecrossmn.com/social impact.
So you can see we have a lot going on within our organization, and it's a really, truly great place to work, and inside our walls and outside of our walls. We have 29 positions open currently, none of them in our northern offices, but with being remote, most of those positions can be located both here and in Eagan. We are currently looking for project managers, scrum masters, nurses, project managers, business analysts that help drive the work that we are doing. We have one intern position open, although they open up quite a few times throughout the year. They are paid and they vary in duration. They are typically part-time for 6 months. And you can see on my screen all of the ways to look for our careers. We are on careers@bluecrossmn.com. We are on Twitter, Facebook, LinkedIn, and we would love to have you join us as a part of the Blue Cross Blue Shield family. So thank you.
Thank you, Stacy. All right, I'm gonna take over here real quick. Thank you so much to Kim, Taylor, and Stacy for sharing with us today. You all literally covered almost every question we had to your presentations. So fabulous job. I have one that I want to ask, and we'll have you answer it backwards in the way you presented. So Stacy, then Taylor, then Kim. And so what I'm curious about is what you really like about working for your organization.
Sure. So I love our culture. We've done a lot of great work moving our culture across the organization. And I'm a leader of 22, so I love seeing my team grow and develop and succeed in their roles. There's nothing better than that. So,
thank you, Taylor.
Yeah, why I love working for St. Luke's is that kind of how I touched on it in my presentation, but when I interviewed, what was really, here's our mission statement, here's our culture, and I feel like it's always hard to really know what you're getting into before starting. And so I do really love that kind of family feel-oriented type culture here at St. Luke's where, we challenge each other, we work really closely as a team, we're very adamant on really being there for our community. So I just think the culture and the work and, feeling like even if, you're not in patient care, you can really make a difference. And so I think that's probably my favorite part of working here.
Kim?
I would have to say the culture as well. Working at Essentia, it's exposed me probably to the most respectful culture I've worked in my career, as far as coworkers respecting one another and collaborating. I like that there's a lot of opportunities for internal growth, and the values align with my own, and also a lot of opportunity for remote work if that's what you wish to do, a lot of flexibility. So those would be my top things.
Awesome, thank you. Well, I just want to open it up to see if anybody in our audience has a question for our employers before we wrap up. Oh, we got a good question for Kim. Heather, who's on, just got her Minnesota LPN license last month. She's wondering if LPN jobs are only in the clinic or if they are any 12-hour shifts. She's located here in Duluth. And for Taylor, wondering about LPN positions there. Do you have 12-hour shifts? And Stacy, would you talk about nurse positions at Blue Cross? So let's start with Kim, then Taylor, then Stacy.
We typically have the clinic positions for our LPNs at this time. And those are typically a day shift, Monday through Friday.
Great, thank you. Taylor?
Yeah, so we do hire LPNs within the hospital here at St. Luke's. We do have a few openings. I believe I was actually just trying to pull it up right now to see which ones we have open. But we do have positions open. Yeah, we have 2 positions open right now here at St. Luke's, and one of them is a 12-hour shift. So on our website, you can actually see exactly what the shift is, maybe what the hours are before you apply. So this one's a day and night rotation. And it's 12-hour shifts. And so, you can learn a little bit more about that when you apply. But we do hire them in the hospital. And then in our clinics, we do have medical assistant positions. And if you're an LPN, that does qualify as being qualified for those positions as well. So if you wanted to work in the clinic, you could. So we do have both.
Great. And then Stacy, if you want to talk about the nurse positions that are available at Blue Cross sometimes.
Sure. So our nurse positions do require a little bit of clinical experience prior to coming to us. And the reason why is because we help with case management, care management, talking through medical conditions and coordinating care with our members. And so those do open up frequently on our website if you're interested in those once you have some clinical experience.
Great, thank you. Another good question, just curious from the group about therapy positions. Allison, who's on with us, will be accepted into the OT program at St. Scholastica, and is just wondering what the outlook might be in, say, 2023, if there'd be pediatric positions open. I'll just open that up to anyone who wants to answer.
I think it's hard to say about the specialty, but we're oftentimes looking for therapists. So I think the profession as a whole has a great outlook. It's hard to predict what specialties will be open.
Yeah, thank you.
Yeah, I have to agree. We do hire that area here at St. Luke's. It just really depends on what's available. And I always just encourage people, even if it might not be exactly what you want to do, maybe apply and see what it entails, because a lot of the times we like to move people around internally if we can.
Thank you. Awesome questions. All right, well, we're wrapping up here. So just another thank you to our employers who are here with us today. A reminder that our next session is Tuesday, May 18th at 4, where we will dive into community involvement and social impact in our region. And just thank you for connecting and for being with us here. And Kim, Stacy, and Taylor, special thanks. I'll be in touch if you want to share slides or any information. We will make sure to send it out to all of our participants today and our candidate pool in North Force.
Thank you.
Have a great day, everyone.
Thank you.
Bye.
Bye.
Bye.